दिस इज़ द इंफीरियर ऑफ स्कल. इससे हमने हॉरिजॉन्टल अपर पार्ट जो है वो रिमूव किया है. नाउ वी आर लुकिंग इनटू द स्कल सुपीरियरली. सो दिस इज़ द सुपीरियर व्यू. सो दिस lesser wing of sphenoid. This is lesser wing of sphenoid. This is a hard part, petrous part. So this is called the petrous part of temporal bone. Lesser wing of sphenoid, petrous part of temporal bone divides the cranial fossa into 3 compartments: anterior cranial fossa, middle cranial fossa, and inferior cranial fossa. Posterior cranial fossa. Anterior, middle, and posterior cranial fossa. Now looking in the anterior cranial fossa. This here is the frontal bone. So here it is the frontal crest. This is called the orbital plate of frontal bone. This is the cribriform plate of ethmoid bone. It has cranial nerve, first cranial nerve inside, and this pointed elevation is called, this pointed structure is called crista galli. It gives attachment to falx cerebri. Falx cerebri is the fold of dura mater that separates two cerebral hemispheres. This is the orbital plate of frontal bone, cribriform plate of ethmoid, frontal crest, crista galli, and here these are the optic canal. It gives passage to optic nerve. ये eyes के through आ रहा है. So this is the optic canal. ऑप्टिक कैनाल से पास होती हैं 2 चीज़ें, ऑप्टिक नर्व एंड ऑप्थैल्मिक आर्टरी. ऑप्थैल्मिक आर्टरी इज़ द ब्रांच ऑफ इंटरनल कैरोटिड आर्टरी. दिस वॉज ऑल अबाउट द anterior cranial fossa. Now coming to the middle cranial fossa. Here the important structures are, see, this is the wing of sphenoid, this is the body of sphenoid, this is the petrous part of temporal bone, here is the clivus, here is the sella turcica, pituitary fossa. Now coming to the foramens. Here this is lesser wing of sphenoid, and इसके नीचे this fissure right here is called the superior orbital fissure. Superior orbital fissure gives passage to 3rd cranial nerve, 4th cranial nerve, and 6th cranial nerve, and superior and inferior ophthalmic vein. This is the supraorbital fissure. This right here. Now these are the foramens 1, 2, 3, and 4. The first foramen right here. This is called the foramen rotundum. This is the foramen ovale, foramen spinosum, and this is foramen lacerum. Now let's assume यहाँ पे है एक trigeminal ganglion. Trigeminal nerve, 5th cranial nerve के 3 branches होते हैं: superior ophthalmic, middle maxillary, and inferior mandibular. So trigeminal का ophthalmic part गया ऊपर, ophthalmic division. Now maxillary division आया यहाँ पे in the foramen rotundum. So foramen rotundum का content is maxillary nerve. उसके बाद उसका second division mandibular comes here, foramen ovale. Now foramen ovale के structures are very important. It's a mnemonic called MALE. So male structures passes through foramen ovale. What are those male structure? M stands for maxillary nerve, A stands for accessory meningeal artery, L stands for lesser petrosal nerve, and E for emissary vein. These are the structures passing for foramen ovale. Now foramen spinosum. 2 structures passes through foramen spinosum. One is the middle meningeal artery and other is nervus spinosus. It is the recurrent branch of mandibular nerve. So foramen rotundum, maxillary nerve, foramen ovale, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein, foramen spinosum, middle meningeal artery, and nervus spinosus. Nervus spinosus is the recurrent branch of mandibular nerve. Now here this is the foramen lacerum. Foramen lacerum के थ्रू पास करता है internal carotid artery and sympathetic plexus. Now foramen lacerum is usually covered with cavernous sinus. So foramen lacerum forms the floor of the cavernous sinus. This was about the middle cranial fossa. Now coming to the posterior